Well, this crime map, filled out with information provided by the Jacksonville Sheriff's Office, shows a snapshot of just some of the violent crimes reported across the city over just the past few days. This includes more than 111 assaults, shootings, and robberies. 111. Mayor Lenny Curry is asking the state for money to fight crime, and that includes $750,000 for Cure Violence. Now, a new study is looking closer at shootings involving children. A First Coast trauma surgeon is looking into cases in Jacksonville over 20 years, where they happen and what can be done. Alex Osiris is on your side tonight explaining the impact these findings could have on solutions.
This is zip code 32209. When you hear Northwest Jacksonville, this is most of it. In 2008, there were 24 kids, that's under the age of 18, who were shot. Our source for those numbers was where those kids were treated, here at UF Health. It's part of a multi-decade study by doctors looking for solutions.
If you overlaid the gunshot wounds in the areas that were deprived, they were the same neighborhood. So even though the incidents changed, the neighborhoods stay the same.
Dr. Marie Crandall has spent decades in trauma centers across the nation. When she landed at UF Health a few years ago, she began looking into Jacksonville's gun violence. Maps of Duval County zip codes where there were instances of gunshots treated at UF Health. Crandall says areas with low income, low education, and limited affordable housing scored among the top factors in places where gunshot wounds were more frequent. The study noted policing programs, quote, do not seem to have significantly affected incidents of pediatric gunshot wound injury and death. However, Crandall and fellow researchers found that areas that improved largely had the same attention.
For neighborhood rejuvenation, regeneration, or neighborhood investment, which suggests that investment in communities might be a solid strategy to help prevent gun violence.
Crandall and her colleagues have started a new study looking at adults with gunshot wounds and how investment in communities can make a difference. That's still a work in progress. Reporting from UF Health, Alex Osiris, First Coast News, on your side.